My name is Marie Jobson, and I was diagnosed in May of 2013, where I found out I had stage 2B breast cancer. And at that point, chose to do a double mastectomy and went through 8 rounds of chemotherapy for about 4 months. I knew that once I identified my plastic surgeon that full reconstruction was the way that I was going to heal and was going to be part of my recovery. My amazing plastic surgeon, Dr. Zeiler, is very forward thinking in terms of clinical trials for her patients and quickly identified that I was a candidate of air expanders, and at that point I made a decision to be part of the trial and really kind of help other women go through the process by making the product and having it as a possibility for women going through breast cancer as well. I was very familiar with the traditional techniques of using saline, but really was intrigued by the fact that I could control the expansion of my tissues at home, at the privacy, and without needing the use of needles. The most difficult part would be the time period in which the tissue needed to expand, because I knew physically that was not what it was going to look like, and just see your body at a state where, you know, for me, breasts were important. I breastfed 4 of my children and had an intimate time during the period that I had that time with them, and I chose to have it all taken away. It completely taken away my femininity, was emotionally hard. I said to Dr. Zeiler, go big, go home, and I got my wish. I'm better than I was when I was before my cancer diagnosis. And not only physically, but emotionally, I know I can handle things that are rough spots in my life. That was really critical, and as well as mentally. My advice to women looking at potentially reconstruction is seek out advice from other women who've had reconstruction. I think it's really important to understand the different processes in which you can have reconstruction, and take the time to really look at your doctors and having a relationship with them, because ultimately they will be your partner in getting what you need, getting a really good reconstruction, and as well making sure that they are board qualified. It's key that they have the certain degrees to really get a really good end result as far as reconstruction.